Let's talk a little bit about Obamacare. One of the things we hear a lot about is that Obamacare is going to drive up premiums. It's going to drive up rates. Now, my name is Katherine Woodfield. I'm the author of Don't Buy That Health Insurance, and there's pretty much nothing in here about Obamacare. What this book does give you is a tool to understand how we got to the situation that we're in and a structure to hang the information on. And one of the things about Obamacare that we all need to understand is that the federal government is actually the nation's largest insurer right now. Let's see who's already on the health insurance plan for the federal government. So we have everybody who's over the age of 65. And with all due respect to these wonderful, very wonderful people, if you've been using a piece of equipment for 65 or 70 or 80 years, you know, it's more likely that it's going to break a little bit more often than the pieces of equipment that we've only been using for 20 or 30 years. So they're kind of a higher risk group, right? The federal government also insures the armed forces. What do we do to them? We put them in front of bullets. Very high risk group, right? We also insure the sickest of the sick. God forbid your baby is born with a hole in its heart. It's cut right out of the family plan. Your family's not supposed to go bankrupt. You can get them right onto Medicaid. You get that kid right off your plan. So right now, the federal government has the oldest risk population, the most dangerous risk population, and the sickest population. The health insurance companies have cherry-picked very plumly the healthy people who go to work every day. So if we put some of the healthy people who go to work every day on this really dark, expensive plan, is that really going to drive up all the rates and the premiums? This is not a premium driver. Now, the administrative and the creating the systems and so forth, there's absolutely cost associated with this, but putting healthy people on an insurance plan doesn't drive up premiums. So this is a paradigm shift. You've got to sort of start thinking through this. Who's putting the information out there? I don't know about you guys unless some of you own a PR company. But for the most part, I don't have a PR department writing articles, getting it out to Associated Press. So the information we're hearing is coming from somebody who does have a PR department. And in the book I read that I cite very frequently, Wendell Potter wrote a book called Deadly Spin. He actually explained when he was the director of at PR at Cigna for 20-something years, how he learned from the cigarette industry, and he spells it out, he calls it the playbook, for how we taught Americans to make choices that were dangerous for themselves, that cost them a lot of money and were very profitable. They learned that from the cigarette industry. And he spells it out step by step, how you create a third-party not-for-profit organization, then you make donations to the not-for-profit organization, then you staff the not-for-profit organization, and then the not-for-profit organization puts out the propaganda that they want the American public to believe because it came from a not-for-profit organization. You and I don't have a giant voice to go out there and say, this doesn't make sense. So we have to apply some common sense. We have to think through some of these situations. And the thing is, we're great consumers. We know how to buy cars. We know how to buy a dishwasher. We know how to buy houses. But that skill has been hijacked from us as we have gone through our lives. We've basically third-partied off all our responsibility for all our decision-making over to health insurance companies. So healthcare reform, actually, for the majority of us, is great. For us on the street, there's a lot of consumer benefits in it, consumer protections. The actual name of the law, and Obamacare. That's a moniker. It's kind of insulting, right? Who else but a PR company comes up with a moniker that's insulting, right? It's called the Patient Protection and Affordable Care Act. So let's talk about some of the patient protections. If you have a commercially purchased policy, all preventative care should be paid 100% before copays, before deductibles. All your well baby care, all those inoculations your kids need to get into public school, no copay, no deductible, since 2010. So if you went for your annual mammogram and paid a copay and you have depending on the type of policy, you could be owed money. But you don't know that because the insurance companies aren't getting those PR departments out there saying, oh, by the way, you might be paying copays when you really shouldn't be. And you don't get those letters saying, hey, you paid $40, but that wasn't your job, here's a check. So you need to know your rights. One of your rights is that all preventative care is paid 100% before copay, before deductible in commercial plans. And in all the healthcare plans that are being set up in the federal exchange, they will have a basic level of preventative care built into it, completely compliant with the law as it was laid in 2010. You can hire a third-party advocate. If I had known this, you can basically say, I need to hire you to save me some money. I have a $200,000 medical bill here and I can't pay this bill. You know the law, what's right and what's wrong. Can you help me negotiate with the insurance, with the hospital to pay this because I don't have this money? You can actually hire someone and the insurance company can't say anymore, I'm not talking to that person, it's not you. If you're admitted to an emergency room, you don't need to buy out-of-network coverage anymore. Okay? First of all, if you're not being treated for a disease that you don't currently have, you don't need to buy insurance to cover you for a doctor you're not seeing. Okay? So when you get the disease, we'll worry about whether or not the specialist you want to see is in your network. Right now, you're not being treated for a disease. Don't buy coverage for something you don't need. So let's say you're on vacation in Colorado and you go skiing and you break your leg. Under healthcare reform, the law says if you're insured and you use an emergency room for a true emergent care visit, you must be billed out as if you were being billed out in New Jersey or in your home state. So whatever the terms are of a HMO contract in your state are the terms that you're responsible for paying. Now you may get some little love letters from the doctor saying, well, you know, I'm still not whole for $5,000, in which case you go to that patient advocate and you say, wait, can you go over the law? Here's what I've got. And if the patient advocate can turn around because they know the law, and it's like going to an attorney, and they're like, yeah, you do that again and we'll start a lawsuit. You can't do that. It's illegal what you're doing. It goes against federal law. You have to do it this way. That's all it is to it. You need to know your rights, and you're right, there are a lot of rights for us as consumers in the Healthcare Reform Act. There are problems for companies. Remember, we've decided that we think companies should be the route that people access insurance through because they might get a group rate. Well, there are companies who have built their competitive edge. The reason that their price is so much lower than everybody else is because their employees don't have access to health insurance. It would completely change their cost structure. They have a problem. But it's not my problem. It's their problem. Why would you ever give away consumer protection? One of the things that's going to come out this November, in theory, is standardization. Right now, it's very difficult for us as consumers to look at policies and figure out apples to apples. What am I comparing to what? One of the parts of this healthcare reform is standardization. All plans are supposed to be put in a standard format so you can finally start explaining things side by side, looking at things. And what's the number one number you're going to look for in your health insurance plan? MOOP. Anybody know what that means? Maximum out of pocket. Insurance is for disaster. In the worst case scenario, how much is it going to cost me? What is my maximum out of pocket? And it may be worth going to the exchange because there's going to be, I kind of envision it like that progressive lady, like there's going to be shelves and shelves of policies, right? And you might find a lower premium with a lower maximum out of pocket, and the rest of it is just bells and whistles. You can pay for that. If you can drop your premium by a third, and you can lower your maximum out-of-pocket risk, that's what you buy insurance for. And all this little ear infections and sinus infections and little things is not what you buy insurance for. You can just pay for that because it's day-to-day expenses, and the reason costs are out of control is because day-to-day expenses have been welded to our insurance policies, and we need to unweld them.